Almost 1 million people in the UK have heart failure.
More suck, more vent.
The heart is, in simple terms, a muscular pump. If that pump fails, no other organ can work satisfactorily.
Another 900,000 have damaged hearts but don't know it, and the number is rising.
He was having a heart attack all night. If we'd have just brought him in that night before, it could have been a whole different story.
For the worst affected, their only option might be a heart transplant.
Okay, Ellen. Love you. Bye.
But Britain is now facing a critical shortage of donor hearts.
When you die, let's hope you go to heaven or wherever, you don't need your organs to go with you.
Doctors at one of the country's leading heart transplant hospitals are facing increasingly difficult decisions about their sickest patients.
You're all right, sweetheart, you're all right.
We had to open up your chest and physically put pipes in there. Some of the heart muscle has died.
This is the story of 3 men as they find themselves on the uncertain road to surgery that could save their lives. The Queen Elizabeth Hospital, Birmingham, is one of the largest organ transplant centres in Europe. Each day, patients with heart failure come here to undergo life-saving treatment.
I could just be lying there now and then just get out of breath.
25-year-old Reese was diagnosed at 3 months old with a condition that means his heart struggles to pump blood. With daily tablets, he's been living an active life, without realising that inside his heart has deteriorated.
Yes.
8 weeks ago when I started feeling ill, I sort of thought I had a chest infection. I get a lot of chest infections, so I just thought a couple of days I'd be okay, which I wasn't. I didn't go to the doctor straight away, that's me all over. And then I started getting home from work really tired, loss of appetite, shortness of breath. I said I feel achy, and people in work were saying I looked ill. So you start to sort of realise a bit then, you really should go to the doctors.
Scans have shown that Reese's heart is now only working at a quarter of its normal function, and a transplant is his only option. But he doesn't yet know if he's a suitable candidate for the surgery.
When Doctor mentioned transplantation to you, did that come as a huge shock, or did you know it was coming?
Massive shock.
Massive shock.
Yeah.
And that was quite recently, wasn't it?
Well, 2 weeks this Wednesday.
It was the
15th
of June, and it did not come as a shock to me at
all.
all.
No, but we have had it. No, we have been aware that the.
Reese has been ill for about 9 weeks prior to that.
No, we have been told that the only solution would be a transplant. You know, there's not another operation that could help. We've never been told that. So.
Lead nurse for transplant, Sharon Beer, counsels patients from the time they are considered for a transplant to the rest of their years living with a new heart. She must often deliver difficult news.
Transplantation's not easy. Supply of donor organs in this country is not good. Okay?
Yep.
We can only do what we can do with what we're offered. We will be honest and tell you the truth, because this is end-of-life stuff and we want the best for you.
Yep.
Okay?
Reese will now undergo 3 days of tests to determine whether his other organs are healthy enough to cope with a transplant.
It's never easy to hear that your heart is in a mess, really, is it? No matter how many times I've heard it now the last week or so. I kind of kidded myself that I was feeling a bit better and maybe things would improve. But, you know, it's better to know how it is, and I hope that I'm suitable for a transplant. If my body's not suitable, there's nothing I can do about it, is there? I think it's looking promising.
I don't think he completely believes. I think he's a very intelligent boy. I'm sure he understands, but I don't think he can believe that it's happening to him. I don't think he's accepted that yet. This week will be difficult for him. I'm terrified. I'm just a bit scared.
If Reese is listed for a heart transplant, he will join 140 patients on the national waiting list. Because of the scarcity of donor hearts, doctors must make difficult decisions about allocating organs to those who need them most.
I wouldn't say I get too sad about it. There's definitely there's worse people off than me. There's worse people in here off than me. I've seen them.
62-year-old Bill is on the heart transplant waiting list after 16 years of heart problems. His doctors say there's no known cause.
It's very strange waiting for a heart. Very strange. You're thinking all the time. You don't stop thinking, waiting and wondering who's the poor unfortunate that's, got to pass away, to make me live.
Bill is now dependent on intravenous drugs that induce both sides of his heart to beat. Without a transplant, his doctors fear he won't survive longer than a few more weeks.
It changes your life. Facing death without this, or you've got a chance with this, and I've got to take the chance. I can't leave my wife.
The hospital's heart transplant programme is led by surgeon Professor Robert Bonza. During his career, he's performed thousands of heart operations, including 250 heart transplants.
Over the years, we've been able to develop therapies that could help many more patients with advanced heart failure. The tragedy is that we don't have enough donor hearts to treat everybody and to fully utilize all those possibilities.
Professor Bonza has seen the number of adult heart transplants carried out in the UK drop by 2/3 to less than 100 each year.
We commonly have patients who are in critical care, who are dying in front of your eyes, and we are urgently waiting for a heart.
More advanced emergency medicine and improved road safety mean fewer young people are dying and becoming donors. Britain also has a low rate of people agreeing to donate their organs after death. Donor organs are only obtained from patients who have died in hospital. Their families must give final consent for their organs to be used.
Knowing that your loved one has died is terrible, but that they have died and helped multiple other people, I think should give huge succor and support to families.
It's 3 a.m. and a donor heart has become available that is the right blood group and size match for Bill. Doctors at the Donors Hospital must examine the organ to make sure it's healthy enough to transplant.
He's been prepared. He knows now that the next time he sees me, it's either to tell him that we're going to theatre to start the operation, or that the donor heart's not suitable.
As hearts are now coming from older donors, more are found to have hidden disease. Half of the hearts inspected by the transplant team have to be rejected because they're not safe to use.
The theatre staff are ready. We're just waiting to hear if the donor heart is suitable on inspection. Should have the call through in the next 20 minutes or so. Hi. Yeah. Okay, right. Thank you very much. Good night. Bye. It's off, I'm afraid. Donor heart's not suitable on inspection. So thank you very much, and I'm very sorry. We'll go and tell the patient, then we'll tell the intensive care, yeah. Hiya. How are you doing?
Fine.
Are you all right?
Yeah.
It's not good news, I'm afraid.
Oh.
Not good news. Very sorry. They've looked at the donor heart, but sadly it's not suitable for transplantation, I'm afraid. We've tried for you.
Yeah. What a shame. I'm looking forward to it.
So are we. So we'll try again for you.
So all I can do is, you know, wait.
Cup of tea?
Yeah.
Cup of tea?
I'll have a cup of coffee, I think.
Cup of coffee?
Coffee.
Okay.
Yeah. No.
We keep trying for you.
What a shame.
All right.
That'll happen soon. That'll happen one day, won't it?
We hope so, yes.
Yeah. Yeah, it will.
The human consequences of the donor shortage are profound. It's a haunting experience, that shadow of uncertainty. You're waiting for this precious commodity that you don't know when it's going to come, you don't know if it's going to come. In Bill's case, it's enormously brave, and that to an extent is a front, because internally you have to be terrified as well. The disappointment is that you may not be able to help him at all if another heart doesn't become available.
At Birmingham's Queen Elizabeth Hospital, 25-year-old Reese has been told he needs a heart transplant because his congenital heart condition has worsened.
I want me to get better. It's back to how things were about 3 months ago. A stable life, but from what they're telling me, that's not going to happen. It's never improved. It stayed the same for long periods, my heart condition, but it's never got better.
Before Reese can be listed for a transplant, cardiologist Dr. Cern Lim must make sure his body could withstand major surgery.
Just rest your head down. The heart is a muscle, so when you clench a muscle, it thickens up, just like when you flex your biceps. Reese's heart is a bit like a sponge, a bit like cheese, with all holes and soft, squidgy, rather than tight, compact muscle. It doesn't work efficiently as a muscle pump.
The left side of Reese's heart has been deteriorating from birth. Dr. Lim has detected that the right side is now beginning to fail too.
His chances of survival over the next 10 years without a heart transplantation is probably less than 50%. Just breathe in and out. Hold it down.
A fine tube is now inserted into Reese's heart through a vein in his neck. This will measure the pressure at which blood is flowing from his heart to his lungs.
I felt my heart racing once or twice, but that's because they're putting things into the veins.
What is it? 20 and 10? 10. His pressures are a little bit high, so we're just going to get an infusion ready to see if we can bring the pressures down. If the pressures are too high, then he may not be suitable for transplant.
Connected to patient.
4.2. Hang on, this is the expiration now. There you go. Okay, this is a new wedge here for you.
Breathing for me, Reese.
The medical team will now need to analyse whether the drugs can keep the pressures low enough to proceed with a transplant.
It sort of frightens you and to the point where you think, God, am I going to live past 50 or, whatever, because that's a young age, It does frighten me.
But even if Reese is put on the transplant waiting list, he could face a long and unpredictable wait. There is a critical shortage of donor hearts available in the UK, and the problem is set to intensify.
The epidemics of obesity and type 2 diabetes and so forth that we see now could generate a huge pool of patients with advanced heart failure who ultimately we will not be able to treat.
The medical world is trying to develop alternative ways to save patients who need new hearts. Using stem cells to regenerate or grow a heart is one of the most promising fields of research. But these techniques will take years before they're ready to use on patients. Mechanical devices that take over the heart's pumping function can now sustain some patients for over 5 years. But these treatments don't provide the same quality or quantity of life that a human heart can give.
For the next 5 to 10 years, I believe that we will remain largely dependent upon human-to-human heart transplantation for those people who need it.
Bill has now been in hospital for 6 weeks, urgently waiting for a transplant. After a donor heart had to be rejected at the last moment because it wasn't beating correctly, ward manager Jane Downs has become worried about how Bill is coping.
We noticed that he wasn't conversing as much as he had done. He was a bit reluctant to do just basic things, really. He just wanted to be left alone and just left to sleep. I think he's worried about how long he's going to be here. Is he going to get worse and possibly die? And he has expressed that because he's sort of watching the time and, you know, counting down the hours and the minutes.
Bill has also become anxious about what is happening around him in the high dependency unit.
It's an old woman dying. In there. That's what the noise says. It's shocking her. Nothing's happening. And you hear the continuous line. And I think that's what's happening. You'll soon know if they shut the units. Horrible. Scary. It happens a lot in here. You shut the curtains and somebody goes missing.
Staff are encouraging Bill to keep mobile. Maintaining his muscles will make recovery easier after surgery.
You ready for your walk?
Yeah.
And trying to keep active might also lift his mood.
Get your legs in action. Pick your own pace. How's that? You all right?
Yeah.
Not going too fast?
No.
You sure?
Yeah.
You're going a bit skew if you need a rest. You feel a bit dizzy then? You're going faster than I am. Stop for a breather. Because you haven't used your muscles.
No. Oh. Huh.
Hard work.
Oh. Simple walk.
Okay.
Yes, told you.
Can you manage?
Yeah.
We've worn you out now, haven't we?
The results of Reese's tests are through.
Hi, Babs. How are you? All right, Dr. Lim will see you now. Is that all right? Are you sleeping at night?
I had a bit of a headache.
We looked through all the results and all the tests that you have had done over the last few days. The good news is that we know that the other systems in your body, your kidney, your liver, everything else is working well.
Good.
We know that your heart is weak, but there is that concern about the pressures in the heart and the lungs. So what we're going to try and do, put you on a tablet and see how you respond to this new tablet in about 6 weeks or so.
Yeah, still waiting really. It's not really the answer we wanted. It is a little bit frustrating, but like I've said before, it's not really in my hands, is it?
Not knowing when treatment will come can take its toll on patients' families too.
I will just another 6 weeks now, man. Just another 6 weeks of
It's
worry.
easy for everybody to stand back and say that in every, they haven't got to live our lives.
I know that.
Yeah, I'm in our shoes.
I know it's another 6 weeks of worry, Mum, and we'll just have to face it all together.
6 weeks on top of 25 years. This is not over, is it? Let's be honest.
Fucking head
I
in.
can't just go home and pretend it hasn't happened. It's 6 weeks of hell for me. I'm watching you every minute of every day, worried that something's going to go wrong. Again.
It's not easy for any of us, Mum, I know. It's not easy for any of us. It's difficult for me to think, am I going to send myself back to work and effectively kill myself off, like?
Rhys has been prescribed several tablets to ease his breathlessness and fatigue.
What the hell's that?
Spironolactone, once a day.
All the same, just...
Yeah.
Yeah. What's the other name?
Sildenafil.
Yeah, there we are, we'll call it that.
Half a tablet once a day.
Viagra is often used to relax the pressures around the heart.
Yeah, me too.
While Rhys and Bill have been in hospital, their families have become friendly with each other.
Hello. Hey, Rhys. How are you doing?
This is a chance for Rhys to get an insight into what it might be like if he is put on the waiting list.
What have they got you hooked up to then? Got you hooked up to all sorts here, have they? Your heart's packing in like mine is.
Oh, it's packing in alright.
How did you take that at first?
I was very upset.
Same here. It's a kick in the teeth, isn't it? Yeah, definitely. How did yours go bad then, Bill? If you don't mind me asking.
Well, I've had 3 pacemakers. It started when I was 46. I fainted.
The first time they considered giving me one of them was when I fainted. I was, told that my heart was a mess. Do you know what tablets they put me on?
Viagra.
Yeah.
All things they put on.
Yeah.
He said he was going to be awake all night.
Yeah. They got me on that.
You took that as well?
Yeah, but not for that reason.
Yeah.
Oh, no.
But you look after yourself. Drop me a text, right?
I will
Look
do.
after yourself, okay?
Oh,
Cheers,
thank you.
Bill. Thanks for your
Bye.
time. He's ill, isn't he? Yeah. Jesus. How he copes every day waiting, I don't know. It just made me feel lucky the way I am. Lucky that they've caught how bad my heart is now rather than let me get that bad, because it must be a nightmare for him being stuck in hospital.
The next few weeks will prove to be critical for both Bill's and Rhys's lives. Doctors at Birmingham's Queen Elizabeth Hospital must make difficult decisions about patients whose lives might be saved with a transplant.
Pop some more electrodes on you.
42-year-old Andy Dutson was a healthy and active father of 4 until 3 months ago, when he had a major heart attack. This is when a blood clot blocks a coronary artery, starving the heart muscle of blood and oxygen. Andy and his wife Bev are now getting to grips with the fact that he might need a transplant.
Once you've been in hospital for such a long time, it's just like being a baby, I suppose. You're trying to walk and talk, and it is a confidence thing. Obviously, going out and about, it can be quite nerve-wracking to get out to that door, because you've been in close such a long time, and people have been looking after you. I try and have a walk down the road, perhaps by myself, and then I realise I can't get back because my legs are too tired.
Andy was in and out of consciousness at the hospital for 5 weeks. His other organs began to shut down as doctors tried to save his life, but he has no memory of his ordeal. Bev was with him the night he started to feel heartburn and nausea. They thought it was a stomach bug which their children had had. In fact, he was suffering from a prolonged heart attack that caused sudden and severe heart failure.
I got a bit, it was a shock to see him on intensive care. I mean, I thought he looked bad before, but to see him monitored, I mean, it was everything, you know, with the outfit. He was on dialysis, he was on the ventilator, and I think that's really hit home how close he come to dying, really. He didn't know if he'd recognise you. And then you just think, well, perhaps that isn't Andy then. You know, to me, he wasn't my husband, you know, on the bed. He just wasn't anything like the person I knew and I've lived with. Which, that's the hardest bit. You don't know if you're going to get them back.
A nice deep breath in and out.
So all the time I kept thinking of, well, that we went to bed and he slept on it. He was having a heart attack all night. If we'd have just brought him in that night before, it could have been a whole different story. Which, the guilt with that was taking me a long time. Even now, I think, well, if only a few hours earlier, it could be completely different. But that isn't a healthy reaction, you know. We've got to think that we can't have a magic wand. We can't turn the clock back. We just have to face it with the hand we're dealt.
Andrew Dutson.
2/3 of Andy's heart has now been left scarred. But the shock of his fast and sudden decline has left him struggling to understand why he might need a transplant.
He's 42 and had a big extensive anterior infarct. Had quite a difficult time when he was in hospital.
Please tell a story. There's no flow into that area at all.
Did he really understand how sick he is? Is he just blocking it out?
No, I think he can't remember any of the ITU stay at all. So he was asking questions like, how did I end up with a scar, you know, in his chest? He feels better, so he's thinking, oh, you know, I'm a bit better. Do I still need it?
If he doesn't want to proceed, that's fine. But I want him to come in anyway.
What I said to him was, look, there were some markers that suggest that, you know, he's not as well as he feels.
I think this man needs to sit down and just talk about where he is, because he doesn't know.
Yeah. Do you want to come in?
We'll talk to him. Yeah.
Oh, yeah. Hey. So do you remember much about what happened?
The time I was in hospital, no, not really.
Not really? No. Okay. It's not surprising. I mean, you've been through quite a bit. We had to open up your chest and physically put pipes in there. These are kind of pumps, really, to take over the pumping function of your heart.
The actual work, yes.
Yeah. So that's how you ended up with this big scar.
Oh, that's why I was
cut
down there.
Because we had to open it up to get access to the heart. We know that obviously the heart attack has caused quite a bit of damage to the heart. And a lot of that damage is not going to be reversible, and some of the heart muscle has died and replaced by scar. You know, we want to see whether you would benefit from transplantation. You know,
could he just deteriorate quite quickly, or could the heart?
It is possible. We think that at some point things will start deteriorating. That's the kind of natural history with your condition. The natural progression is that, you know, things tends to get worse with time. But then again, everything gets worse with time, you know. Yeah. We all get worse with time.
Do we know how long?
No,
this little tick of year is going to last.
That's the $1 million question. I mean, if all the tests suggest that it is safe to wait, then we would. Yeah. But we have to be comfortable that, you know, that is a safe enough thing to do. What we don't want to do is, you know, we say you don't need a heart transplant at this point, and things get worse very, very rapidly, and then we're kind of back at square one. We don't want you to end up in where you were before, where you were too sick for even for transplantation at that time.
Bill needs a transplant within weeks to survive, and another donor heart has just become available.
Counting the minutes for this.
2 hearts have already had to be rejected as they weren't healthy enough to use. The function of this organ is now being assessed. The decision on whether the heart is safe to transplant is now in the hands of Professor Bonza.
If we can move forward for Bill, that's fantastic. It's a feeling of apprehension because we want to make the right judgments now about the donor heart. We want the operation to go well and smoothly. We want that new heart to work satisfactorily. It's when they go home, that's when you can sit back and be pleased, as it were.
If the organ is accepted, Bill will then face the risks that come with surgery. 1 in 10 transplant patients die from early complications. The decision has been taken.
Hiya, Bill. All right. Have you had a snooze?
Yeah.
Good. Right. Professor's happy with this heart.
Yeah.
Third time lucky.
Good. Oh, good.
Well done. All right.
Yeah.
Thank God for that.
Your wife. Hi, Len. I'm on my way. It's just... Yeah, no. You'll be all right now. Don't worry about anything. He'll be in touch with you. Yeah. Okay, Len. Love you. Bye. That's it.
As Bill is taken to theatre, the donor heart is being surgically removed in a hospital 200 miles away. It will then be cooled and preserved before beginning its journey here.
Okay to start?
The donor heart will only survive out of circulation for 4 hours. Every stage of Bill's surgery must now be precisely coordinated with the movements of the organ.
Good, good.
The surgeons now open up Bill's chest. The heart's about 3 times the normal size. Look at that.
Surgery can't continue until the team is confident that the organ is approaching the hospital.
The professor won't actually take the heart out until we know the heart's 20 minutes away.
As soon as we remove his diseased heart, we are then absolutely committed. Because we couldn't put that back, it wouldn't work.
20 minutes, okay? We're going for the box now, yeah?
20 minutes.
Bill's old heart must be removed now so that no time is lost once the new organ arrives. His breathing and circulation are now taken over mechanically to keep him alive.
Here we go.
Right, we're here.
Okay, let's have it.
It's a negative into a positive.
The heart has been in ice for over 2.5 hours. The team now has 85 minutes left to connect it to Bill's system and restart it.
So as quickly as possible and as accurately as possible, because now we are against the clock. Rewarm the pleaser, yeah? Yeah, rewarm the patient as well. We're giving it a blood supply now. It's given a few feeble beats, but we have to wait now for it to recover from the time it's been without a circulation.
Bill will now be continuously monitored for 2 weeks in critical care.
We're very content that the new heart is working satisfactorily. We couldn't ask for a better early outcome.
But Bill's body could reject his new heart at any time. Immune suppressant drugs help prevent this, but these, in turn, increase the risk of dangerous infections.
There's a lot of hurdles still to overcome.
It's been 5 weeks since Reese went home, but he's been rushed back to the hospital with serious complications.
It's just one thing after another all the time. started having pains in my ribs there. Well, we didn't think, we were thinking it might have been heart or something, but yeah, it was my lungs. And blood clots had formed on the lung. And part of the lung had died off a bit. Some of it has died off, but...
The blood clots have formed because of the sluggish flow of blood through Reese's lungs. His doctors hope drugs will dissolve the clots, but they must now decide whether this setback makes him unsuitable for a transplant.
It's just a sense of reality that there's no getting away from it. You know, wherever you go, whatever you do, there's no getting away from the fact that you need a heart transplant. Even if your head sometimes forgets about it, you know, you can't, your body doesn't forget. Because obviously your body's struggling.
Dr. Lim is retesting the pressures between Reese's heart and lungs.
Can you just do respiratory variation there? Big breath in. And out. Did we get that?
Not the end of the world if it hasn't worked. The Viagra tablets. It's not the end of the world. But, you know, it's in the doctor's hands, they know what they're doing. Trust them. Obviously your heart keeps you alive. So, when they're putting a new heart in you, there's risks, I know that. But, I don't want to mention death, but, you know, I don't think about that. So I'm positive, so. But,
the pressures have come down as we wanted it to, and it's come down to a level where we would be prepared to offer transplantation.
Safe enough level then, yeah.
Yeah. The concern obviously is the clot in the lungs. We prefer to leave it for a few weeks for it to heal up a bit more before we put you on a list for transplant. So that's the only kind of last hold up really.
What sort of time span does it normally take on average?
We say about 6 weeks. The blood clots happened last week, so that means 5 more weeks from now.
It's not exactly what I wanted, but yeah.
Not ideal, yeah.
To you, I'll be honest with you, because Rhys would disagree with me, but I have seen him go downhill from the 6 weeks ago to now on a daily basis. So what frightens me is
I don't
that
agree.
6 weeks from now, the rest of his body's going to be affected.
Yeah, well, they can monitor that by doing echo scans and things,
I'm
man.
not disagreeing with the doctor, I'm just expressing my concern that, you know, I've seen such a change in him.
But that's also the reason why now we're keeping him a bit longer to tweak the medications to try and stabilise things a bit more.
As long as he's monitored.
Yeah, I'll come back later on and have a chat.
All right then, no problem.
So if you have any questions, then...
Yeah, okay. Cheers, doctor.
Thank you.
So I haven't seen me decline in the last 6 weeks. Well, I don't need people being negative at the moment, so...
Not being negative and being realistic.
Can honestly anyone say that they would be happy to put me on the list when there's blood clots in my lungs? Because am I just the only one under this impression? I'm going to need some time on my own in a bit. I'm fucking pissed off.
The trouble with you, Rhys, is you don't like anybody questioning anything.
Nah.
At the end of the day, you thought you were going to go on the list.
I didn't. I just didn't want to worry everyone yesterday. We were hoping more than anything. I had a feeling in the back of my mind.
And I'm not going to sit here like I'm dumb.
Oh, ma'am, I don't need all this at the minute, like. I don't need all this.
Nobody wants their child to have a transplant, but we know it's inevitable now. And I'll be happier when he's on the list and we can get something done. The worst scenario is that I'm going to lose him. I'm going to lose him, and it's not something I can think about. I have to stay positive.
Heart patient Andy Dutson is about to undergo treatment. After a severe heart attack scarred 2/3 of his heart, doctors believe he will, in time, need a heart transplant. But they don't want to put him through major surgery yet, as he is still able to lead a reasonable life at home.
He's in that kind of grey area at the moment where we have to keep a very close eye on things. At this point in time, the risk of transplantation probably just about outweigh the risk of leaving him on his own as he is now.
To protect Andy over the coming months, he's being fitted with a defibrillator. He's given a local anaesthetic and sedatives, but remains conscious.
If you feel any pain or discomfort, you must tell me.
The scarring in Andy's heart could interfere with the electrical signals that control his heart rhythm. This could cause his heart to unexpectedly stop.
There's always this risk of sudden death from dangerous rhythms. You feed the defibrillator lead down the vein and that will take us to the heart. We find the right spot in the heart, and then the lead has got a screw at the end. We deploy the screw to hold it in place so that it doesn't move. There you go. So once it's all connected, then we put it into the pocket that we made earlier. T-shock induction 15 joules. We're going to test to make sure that the defib works. So we need to trigger off an abnormal heart rhythm through the device. The device will then see it and then deliver a shock, which will then stop the rhythm and reset the back in the normal heart rhythm. Hopefully restart the heart. That's what we want to see. And some people describe it as being kicked in the chest or punched in the chest or something like that. Okay, shall we? Let's go. Okay, that's good.
Well done. All right. You're all right. You're all right, sweetheart. Just relax. You're all right. They were just checking your box, okay?
It's all done.
Oh.
Excellent.
You did a good job.
Yeah, it's all done.
Oh, yeah.
You've done very well. Okay. Try and get some sleep, all right?
Sure. Which is quite emotional, isn't it?
Hey?
Quite emotional, isn't
I
it?
know, I know. You won't be the first, all right? You let it out. Okay, I'll get you some tissues. Okay?
It's been a month since Bill had his heart transplant.
Just take your time now, Bill. Home straight. All right.
Hello, Mr. Proctor.
Hello, Mr. Bonster.
How are you?
Fine, thank you. Thanks to you.
Very good. How's your breathing now?
Smashing.
Is it? How are you getting on with your tablets?
Smashing? Oh, no problem.
Yeah.
No problem at all.
Very good.
How was my old heart?
It was, first of all, it was enormous. So it was in a terrible state, really.
Oh, dear.
And no doubt about the need for this to be done.
Wow.
All right. So if I don't see you before, take care when you go home.
Yeah.
All right. Bye-bye for now.
Bye. Thank you. It's been 6 months of very hard work. 6 months. And I finally got a new heart, you know, which is working perfectly. And a lifetime of tablets. I really did need one. Oh, wow. Very lucky man. I consider myself extremely lucky. Do you want to have a look at it? I didn't realise at all. That's it. I thought it was a little 2-inch cut. It's right down.
It's always satisfying to see a patient get better after any heart surgery. And so the visit when you say bye-bye and good luck for the future is always the best one. Bill goes home, but I worry that we will not be able to help as many of subsequent patients as we would like to. Without the hearts, we can do nothing. We have to try and address that. It would set us in good stead to treat the future problems, and it would be a sign of a highly civilized society in which everybody is doing their utmost to help their neighbour.
Bill went home 5 weeks ago and is slowly returning to an active life with his new heart. Andy's health has remained stable. He will now have checkups at the hospital every 6 months to determine when he might need a transplant. Reese was listed for a transplant and has now been waiting at home for 4 weeks for a donor heart to become available.